welcome to our work session. Who wants to start this off?
That would be me. Commissioners, I've put at each of your places kind of it's a spreadsheet that kind of shows you what the new rates for our insurance are currently proposed at. And we've already had this discussion about moving forward with how we wanted to cover it for the employees and everything. I just wanted to bring it back to you now where we've got our firm renewals. We're getting ready to put together the open enrollment package, which would have this information in it. I just want to go over it and make sure you didn't have questions, comments, concerns before we do that. If you look at the very far right of the sheet, that column shows you what the increase to the employee would be on a monthly basis. There are some that have slight increases, and the reason being the high deductible health care plan is what we consider our entry level, and that's the one that we offer to employees at no cost for just the employee. So that one we held the same. There is no change in the cost for the employees on that. The base plan, which is a little more robust plan, there you'll see there's a slight increase, and on the family, I think it's $28 a month that it would go up if they stay on the base plan. Then we made some changes on the dental and the vision, just because we had a few of those that were out of line with what we were providing in the actual health plan itself. We had some that were at no cost, which should have had a cost associated with them. So I made some changes there. You'll see the actual impact. One of the things that we've discussed is a wellness plan, and how we have a wellness committee that we put together, and they've discussed some things we can do. And what that is to encourage our employees to do the basic things for their own health care. Get their physicals, go see their doctor when they need to, make sure they continue to take their meds. We do the wellness screening, the health screening that we have out the health department each year that we provide no charge. Those things will allow employees to earn points. And what the committee came up with is if they earn enough points, it's going to be fairly simple to get those points if you do the basic things. And then with that, they would get a $50 on the individual plan. They would get a $50 a month incentive if they complete and score enough points. And on the family plan, they can get up to $100 if both the employee and the spouse or one other person would get those points as well. So with that, it actually would give them a reduction in their health plan if they go do those things. So that's what's here. That's what I have in front of you. And that's also what I've included in the budget to this point. And that's why I'm bringing it to you today, just to make sure that you understand it. And if you have questions, if you wanted to make changes.
So, a question about what you just said. Do we offer a smoking cessation?
We have training that we offer if somebody wants to take that.
So, this will be, the incentives will start in 2025.
Well, they'll start with the benefit year.
That's right. We start in October. Yeah. So this fall's health assessment would qualify.
Yes.
Oh, okay. Yeah, that'll work. That's not an incentive to do this.
Yeah, it should be.
It should be. If you could actually lower your.
Yes, you could.
With an increase and then lower it by doing that.
Yeah.
We talked about making it mandatory for the health assessment.
Well, if you talk to our attorneys, there's some challenges with that. There are some states that have had findings that that's not, you can't force that.
Well, and that's fine. I think that's
but you can
individual freedom.
Right, but you can give incentives.
Yeah, as long as you give the incentives.
And that's what counts as incentive going here, but forcing somebody, no. That's a no-no.
That's what I thought.
And I think they have fun things planned to do.
I respect their rights to not go.
Mm-hmm.
That's their choice.
Right. So this is, we went through a lot of different iterations between staff and our broker, benefit advisor, Bukady, just trying to find the best plan that we could still afford. And we made the changes that we discussed earlier. We've also I've included the cost of the incentive plan in here, and you can, at the bottom of the sheet, there's some information on that. It's not free, and all these are based on 100% participation, which more than likely there won't be. I don't know why, but there just won't be. So this fits in our budget as I have it presented here. This fits in our budget. I still think it's a great benefit for the employees, even though there are a few of the plans that have a slight increase. If you take advantage of the wellness incentives,
Yeah.
bring that price back there.
I agree.
Our providers, I mean, when we're doing the sign up, and I think that just in general, a lot of times they give little giveaway incentive things, right, Mr. Sims, that kind of,
Yeah, they do.
encourage and make fun things happen for the employees too
Yeah.
when they're doing benefits.
And the way you get the points, so far what we've discussed is anything that allows you to get the points also has a zero cost because a annual physical is covered under
Right.
the health plan. So those things are also zero cost. So it's not like we're telling employees you have to go spend a bunch of money in order to get this.
Right, it's
Those
all-
are just free things that we want employees to do
Right.
to take care of themselves.
I think also, Mark, what you've done with this is better than what I expected, honestly. What y'all been able to do with this. The employees are very important. Few of us up here have worked for counties or cities or schools or whatever and know how important this is, and also how important to retain. We're talking about firemen, we're talking women, we're talking about police officers. These are important things to make sure we keep up to speed on. So I like what I see right here. I think this is a fair compromise.
The only other thing I'll mention, it's not part of this, we'll bring that policy to you on the wellness plan. I just want to make sure you're okay with that. So we'll bring forward the actual policy to implement the wellness plan for the employees. Probably have that before obviously before October, but with all the budget stuff, it's not going to come up like next week or anything like that. So you'll have that policy, and then one of the other things that I've mentioned a few times, and that is I'm still watching this year and how things play out, and there's still the possibility that I'm going to bring to you to eliminate the sick leave buyout. That is the one thing that in order to make all this work, it just depends on how the budgets come out this year and how people spend their money. It won't be like I'm not going to bring it to you and say, let's do it today, but I will bring it to you before the end of the year if we're going to have to do it. So just to FYI, I may be coming back to you sometime in the next 4 months saying on the January 1, we're going to eliminate the sick leave buyout, and that's the only way that we can afford to move forward with some of the...
Or Mark, could you come back to, I know a lot of cities and counties have been going back and forth with it. Too bad Lansing didn't have it. I left $100,000 on the table. But the other issue is that maybe if there's a compromise somewhere on the buyout. I don't know if that's what it's set up now. I can't remember. If there's so many days that they'll go up to, or...
It's a tiered approach.
Okay.
And it's a wonderful benefit. And,
Oh, it is, no doubt.
If there's any way that we don't have to, I'm going to avoid that. But it's the one thing that has a cost to the county that can help offset some of this if we have to. And unlike in the past when some changes were made where they came in the morning and decided that afternoon you no longer had a death
As of
benefit.
10:30 today.
Yeah. So I want to bring it up today during our work session so that people are hearing what
Yeah.
I'm saying. They can plan accordingly. That by the end of this year, if there's a potential, they at least have that opportunity to think about how that impacts them.
They have the blue flu.
And I will give at least 60 days notice if that's the direction.
Well, that's incentive, too, to keep the people here for a long time. I think, especially people who have been devoted to this county, I also think I hear what you're saying, I still think there's a possibility, and I know some of you don't like using the word tweaking, but I still think there's some things that we could look at to help. Maybe not go what we've set now, but maybe look at something that's not as cost prohibitive as what you're trying to tell us right now.
This will all play out based
Put a
on
cap
how
on the buyout.
budgets
That's what I'm
are
saying.
working out and how expenditures this year.
I understand.
I think we know how that's going to work out with the inflation still going on, but I think we need to look at some other things too.
Yeah. Yep.
You know, to be able to save these benefits. I mean, that's all we got to do is offer benefits. We don't offer top-notch pay. I mean, it's obvious when people leave the county and get paid, $10, $15 an hour more with better benefits.
I used to get chewed on by the city of Lansing, some of those officials that are still there, and some of the past ones, because I thought employees were probably the most valuable thing we had. And by doing just a little to keep them and show them that made all the difference. You lose we all know this up here, especially if you lose the experience, you lose the contacts they have, you lose all this when you start sending them down the road by taking too much. I'd rather put something else off, not our building, but I'd rather put something else
Oh,
off.
I would. I'd rather put the building off.
Than,
To retrain
than,
somebody.
than retrain somebody. I know what it costed for just the law enforcement for a year, and and that goes through all divisions. You got somebody that's an expert, no matter what, or knows the things. The best we can do is we always said need to err on that way.
And next week, when you're going through the budget meetings with all the departments, I think you're going to hear exactly what you just said, which is we've put forth a budget that accomplished the goal that was set by the Board of County Commissioners. But there are things that we aren't doing that we really should be doing. This is like the deferred maintenance and the taking care of the employees to make sure that we can retain what we have because we aren't recruiting new employees in certain positions. So that each department, I've asked them to be prepared to talk to you about what the budget means. One, yes, this budget meets your goal, but two, here's what we had to do to make it meet that goal. And so you're going to hear some of that next week.
Well, I know it's tough times. I just know what my priorities are on that.
We're going to have a hard time listening to outside agencies give their spill, and we're going to have to cut employees' benefits. So that's just me.
I'm good with it, folks.
And just so you know where I'm at, as long as when I talk to HR and they say the majority of people leaving in their exit interviews are because of low pay and benefits, I'm not voting for any cut to pay and benefits until we get that fixed.
I used to see it all the time, and a lot of times the rumors were that it wasn't pay. I can tell you, as a police chief for 20 years, city administrator 15, mayor, I guarantee you 90% of the people that leave are leaving. They like working there, but they're leaving because of the money. And we're not talking being competitive. We're talking about that you would drop so low that they have to make that decision for themselves or the family. Yeah. And I totally get it. Yeah. So I think that should be a priority for us.
Especially when we have inflation going through the roof.
Crazy.
And the numbers that they say inflation is are not what they are.
That's a fact.
They're worse.
I agree on compensation, that compensation is very important. But I do think it's important for people that are watching to know that we have, over the past 5 years, we have raised compensation. This board has been very focused on that, and we've raised compensation by over 20%.
Exactly, trying to make up for the last 25 years.
You're right, Mike.
But we have been working towards that goal, and we have had
it's getting better.
Some accomplishment.
What's inflation been, though?
Exactly.
Well, and
But
it's
nobody's keeping up.
It's killing us.
Well, you couldn't.
Yeah.
There's no way you could keep up with
that
it.
will definitely be a topic of conversation.
We can already tell.
Over and over again.
yeah.
We can already tell, Mark.
There was no inflation.
I was.
Yeah, I watched that too, Mike.
Yeah.
It's not as bad in news as I was
That's
expecting.
what the president, maybe he's been briefed on that.
We just need to make sure that we take care of our employees. I mean,
That's where I stand.
And we have been, and that's right. You're right, Mike. We have been. We have done our best to begin to bring up pay and.
Well, we had to. There wouldn't be nobody working.
Yeah.
Right. I mean, to stop losing because we were bleeding employees. I mean.
Right.
And it's a balance to
We understand
increase
that.
the benefits and then to keep the taxpayers. I mean, it's just a real balance.
Yeah.
When you've lost 87 employees out of 400 over a 12-month period, that tells you
That's
you're
a
not
lot.
paying enough.
Well, I'm
Do you have anything
we'll
else,
get into
Mike?
this hot and heavy next week.
Again.
Anybody have anything else?
I don't have anything else.
No.
Okay.
No. So this is final.
This will
This
be.
is what we have.
There's no more
That's-
surprises.
Nope, this is the renewal for the insurance. This is what will be put in the benefits packets that Bucati is preparing that will go out to the employees.
Okay.
Good.
All right.
Open enrollment will be in September, August, into August. Yeah, so we're good.
Yeah, because it's coming up before too long.
Yes, it will be August.
Yeah.
After 4th of July, it seems like summer's over.
Yeah, it does. Yeah, it does.
We need a motion.
Good job.
I move.
Second.
We're not in.
Right.
We're done.
We're done.
We're done.
We hit
That
the-
was your